Thank you so very much for joining us. Welcome to the Exam Room Live. I am the weight loss champion, Chuck Carroll. We have a healthy half hour on tap for you today. Appreciate you starting your week here with us right here on Facebook and on YouTube. Coming up today, Dr. Neal Barnard is here. He's going to be answering one of your questions. Dr. Barnard, thank you so very much for joining us.
Great to be with you today.
And we're going to be taking a trip out to the Navajo Nation, where coronavirus infection rates have been higher than in New York at the peak of the pandemic. So what is going on there? Why is this happening? And more importantly, what can we do to help? For that, we're going to be joined by Dr. Carolyn Trapp, the Director of Diabetes Education and Care for the Physicians Committee. Carolyn, looking forward to catching up with you.
Happy to be here, Chuck. Thank you.
All right. And if you do have a question for Dr. Barnard, go ahead and post that in the comment section right now. We'll be choosing one in just a little bit for him to answer. But first, let's get a check on health headlines for Monday, June 8th, 2020. Strict shutdown orders earlier this year may have prevented as many as 60 million coronavirus infections in the U.S. Those are the findings of a new study that was published in the journal Nature. Researchers compared the growth rates of the virus before and after the lockdowns were implemented to arrive at their results. To date, more than 400,000 people have died from COVID-19 since the beginning of the pandemic, 110,000 of them here in the U.S. Meanwhile, at least 23 states, as well as Washington, D.C. and Puerto Rico, are seeing an uptick in the average number of cases. That's according to the Washington Post. The overall rate of infection nationwide is also climbing higher, according to records kept by Johns Hopkins. And finally, scientists tracing the origins of the novel coronavirus say it is especially well suited to jump from species to species. Viral cells analyzed for the study contain traces of both bats and pangolins, according to researchers. The group says the virus can essentially shapeshift to transfer from animals to humans by binding to host cells through alterations in genetic material. Those findings are published in the journal Scientific Advancement. And Dr. Barnard, I included that story here today because it made me think back to a conversation that we had with Dr. Michael Greger on Friday's show. And I asked him, what would happen if there were no more meat markets in the world, the meat markets where the virus is believed to have been transmitted from a bat over to humans? And basically what he said was that there was a really, really good chance that we would not be in the jam that we're in today if those meat markets did not exist.
It's true. And as Dr. Greger has pointed out, and many other experts have pointed out, there are viruses that will live in animals' bodies. They live there generally fairly peacefully. In some cases, it's even a commensal relationship. In other cases, a parasitic relationship. But in many of these cases, there's really no disease until the animal is brought in contact with multiple other species, including humans. And the transmission across species and ultimately into humans does two things. One is the virus mutates, it changes so that it can become more infective. In other words, something that your immune system would have recognized before and destroyed, can't destroy it as easily. But the other thing is that the disease that it causes can become either less serious or more serious. And with COVID-19, we just saw all the things you don't want. A virus that became more infectious from one species to the next and much more pathogenic so that people die from it instead of just having a cough. So the point being that we've got to get rid of the live animal markets. That's obviously the first target. And the big challenge we're having from a public health standpoint is people get used to the idea of, well, we've always had these, we had the disease, now it's mostly gone. Let's go back to business as usual. We're seeing that in China, and we've seen that all along in New York, where the live animal markets are still in business. They've got to go. And as you know, the enormous factory farms that are also vectors of disease are still in business, and that's got to go too. Let me, in fact, if you don't mind, Chuck, I want to share on my screen with you, and I want to show you kind of where we are with this virus overall. Can you see this graph okay?
Yeah, sure can.
Okay. Well, this is the death rate in the United States as of, I guess that's Friday, June 5th. And what you see is kind of remarkable. You notice that when we were in March 1st, basically the death rate was pretty close to zero. But it shot up very steeply at the very beginning of April. And in about the second week of April, it had peaked. And now what we're seeing is, in contrast to what we had been hoping, and some people were predicting, which was a fairly rapid drop-off, what we're seeing is this painfully slow drop-off. So when you get to May 1st, yeah, it was a reduction from the peak, but not that impressive. And then you get to June 1st, and we're cut by about 50%, but we're not where we want to be. And then if you extend out to July 1st and August 1st, those dotted lines, that's the projection where we're going to go. So what we expect is not what we had originally hoped for, which was, okay, in 6 weeks, we'll be done with this. This will be bad, but we'll get through it. What seems to be happening is a slow tail off. Let me bring you to Washington, D.C., and this is the cases day by day. The previous slide I showed is mortality, that's deaths. This is actually just cases. And the numbers that you're seeing are the average number of cases on a given day. So back in April 10th, 147. Back in May, we hit a peak, 166. So Friday, we're at about 88. So very much like the national average, we're down, but we are not out at all. Okay, in the maybe good news department, let me share with you an antibody treatment that is now in testing. It's got this complicated name, LY-CoV 555. It's made in a partnership that involves the National Institutes of Health, but along with two companies, Eli Lilly and AbCellera. And what they did, they took a sick person and they took blood samples. And from the blood, they found antibodies to the virus, different antibodies. And they isolated the ones they thought might be most helpful. They then mass-produced these antibodies and tested them in the test tube to see, will they neutralize the virus? And the answer is, yeah, there are some that do. Good news. So where are we now? They have begun safety trials. That is, you bring individuals. They're doing this in New York. They're doing this in Atlanta. They're bringing in individuals. These are sick people, and they are giving them the antibodies to see if it causes any harm. And harm could come in a couple of ways. One is an immediate allergic reaction. It could be some other unexpected reaction to either the antibodies themselves or a reagent. Or the third thing is it can make the disease worse. And we've seen that with a lot of treatments, that you'll get a hoped-for treatment that makes the disease process worse. That's all we're going to learn from these studies that are underway now is it safe? What we are not going to learn from these is, does it do any good? So after they are done with these safety trials, they're going to do what I'm calling efficacy trials, meaning if you give this to a patient, will they actually recover more rapidly, get out of the hospital, not die? So I mentioned antibodies, and the reason that I wanted to talk about this particular treatment is that it raises some issues that I think are really important to everybody watching this, which is, do you live, do you die with this treatment? And also, how are animals used in producing it and in testing it? And is there some new way that can go forward? What I'm showing you, this letter Y, that's an antibody. That's an antibody structure. And the two arms that are kind of rising up toward the top, that's where the antibody molecule will attach. Think of those as your arms raised up, reaching out for a virus to grab a hold. So the pink and tan on the left and the green part on the right, those are the arms that are going to grab the virus. Now, here's what it would sort of look like. This is, I took this diagram from a related antibody, the 47D11, but the little tan Y-shaped molecules are antibodies. And the big blue blob with the spike sticking out, that's COVID-19. And what you see is those little Y-shaped antibodies are swarming around like sharks around a surfer. And their job is to grab a hold, and then they can end up destroying various parts of the virus. So back to the antibody for a second. The old-fashioned way of producing antibodies was frankly horrible. Is horrible because it's still being used. What you'll do is you'll take some protein, like a virus, that you want to make antibodies to. They would inject it into the belly of an animal, and the animal will react by making antibodies to it. Ascites fluid, this is the belly fluid, will well up, and then you draw that fluid off with a syringe, and you isolate the antibodies, and you sell them. And this method of production is still widely used. It's very cruel to the animals. They are effectively antibody factories. There are other related methods where you'll take blood samples from a wide range of animals, rabbits, goats, other animals too. So many scientists have said, we got to stop this. We've got to make antibodies in a better way. Number one, it's cruel to the animals. Number two, you get a lot of mess. When you're getting antibodies out from animals, you get a whole cocktail of antibodies you want and antibodies you don't want and proteins you don't want. So here's the issue. To produce antibodies therapeutically, there are now methods that can be done in vitro, meaning in the test tube. They can be done without animals at all. That needs to be pursued and certainly is being pursued. And the other thing is that the Food and Drug Administration will say, okay, you can start doing your safety tests and your efficacy tests. You can start doing them in the test tube. You can see how the antibodies will behave. Will they neutralize the virus? But before you're going into human trials, sooner or later, the FDA is going to say, I want 2 species tested with this new antibody treatment. One is typically a rodent, a mouse or rat, and the other has got to be a non-rodent, like a pig or primate, dogs. As you know from this broadcast and many others, you often do not get good results from them, and it's obviously cruel. The animals don't survive these studies. So here at the Physicians Committee, we are working on ways of improving the testing methods and the antibody production methods. Stay tuned. We both for animal welfare sakes and good science, we need to do better. Okay, just really quickly, I want to mention a study in the UK. It's called the Recovery Trial. They had 11,000 patients. They randomly assigned them to a variety of drugs. One was hydroxychloroquine, which has been so controversial. They also used dexamethasone and azithromycin and convalescent plasma taken from sick people. Good trial, but the first thing they discovered is that hydroxychloroquine isn't working. They took it out. They stopped that part of the study. Also, though, in a related development, there was a Lancet study published May 22nd, very nice study, 671 hospitals, huge number of patients, observational study, and it looked like hydroxychloroquine was not any good. And that may be true. However, last week the study was withdrawn, and the reason was they looked at their data. They wanted to get more data from some of the participating hospitals. The people who had the data were not giving it to the researchers to do a fresh analysis. So the researchers wrote to the Lancet and said, we take it back. This does not mean that hydroxychloroquine is safe. What it means is they only want good science, and they felt that wasn't it. So stay tuned. Lots more to come.
Indeed, definitely a lot to digest. And Donna, I don't know if you can pull up my screen. I've got this shared right now. You were talking about infection rates, and I just wanted to point something out because I read this weekend and I found it to be fascinating. You take a look at a country like Italy, which also experienced this huge swell of cases. You saw that steep incline that you were talking about. Italy experienced the same thing, but what you notice is they also fell off substantially and quickly and rapidly and did not plateau. But then you flip over to the US, and here we are basically plateaued. And if you look closely toward the end of it, you see that little bit of an incline that I was talking about in health headlines. Is there anything else that we could be doing right now that would help us reach a point like Italy where that decline is as steep as what the incline was?
It's a great question, Chuck. And the one observation that people have made is that when Italy went on lockdown, it went on lockdown. It was a very bad initial phase there in Italy, as it was in many other countries, but the lockdown was quite severe. In the United States, it was much more casual, and so some people are wondering if perhaps the United States was just too slow to really act and did not act sufficiently decisively. All that said, hindsight is always 20/20. I think looking forward, the question now is what will happen here on out. People are getting looser everywhere, including in Italy. They've opened up. You can now go for a walk in the park, and that's certainly getting to be true here in the United States. So we'll have to see what the second half of 2020 brings.
All right, let's open up the doctor's mailbag here and answer one of your questions. And Dr. Barnard, today's is absolutely fascinating. We've chosen one from Sonia, who wrote to us on Facebook. I used to hear so much about the benefits of bone broth for gut health. However, I'm going plant-based now. So how can I heal my gut? Are there benefits to still drinking bone broth that I can't find anywhere else?
Okay, great question. Thank you for raising that. You just so that everybody's on the same page, in your digestive tract, you have bacteria. That's normal, that's good. Bacteria help you in a great many ways, and they work with you in a cooperative relationship, so to speak. However, there are many different species of bacteria, some of which are healthful for you and some of which are not. What really determines the healthfulness of the bacteria, really it's the high fiber foods. Fiber means plant roughage, but when you swallow your whole grain bread or your beans or vegetables, the fiber part isn't digested early on. It's not digested in the stomach. It's not digested in the small intestine. So when it finally arrives at the large intestine, the colon, that's where the bacteria say, breakfast has arrived. And so they can be nourished by the fiber that has arrived there. So let's say your diet is Spam and Velveeta. These are not plants, so they don't have fiber. And so unhealthful bacteria tend to grow. When you have a plant-based diet, you tend to do well. But a couple things are important. One is, number one, to have plants. Number two, to have variety. So vegetables have one effect. Fruits have a separate effect. So having vegetables and fruits is better than having just a big serving of vegetables. Beans and the other legumes like lentils have their effect, and whole grains have theirs. So you want to get them all. You don't need yogurt because that just introduces tiny traces of new bacteria that they shoveled into the yogurt at the factory. But your natural bacteria will propagate on themselves on their own without adding bacteria at all. So what about bone broth? Bone broth is one of these products, I'm sorry to say, where the marketing has gotten way ahead of the science on it. There is no need whatever for bone broth for a healthy gut. You are better off without it, and what your healthy gut needs is the high fiber foods, especially those 4 groups.
All right, Dr. Barnard, greatly appreciate that. If we didn't get to your question today, have no fear. Keep on posting that in the comment section. We do keep a list of everything that comes in. And if we can't get to it today, there's a good chance we might get to it tomorrow. You can also tweet them to us at PCRM or at Chuck Carroll WLC using the hashtag Exam Room Podcast. Dr. Barnard, greatly appreciate your tips today, my friend.
You bet.
All right, moving on. In April, images coming out of New York City were absolutely heartbreaking as tens of thousands of patients overwhelmed hospitals. Not enough ventilators. More people were dying seemingly minute by minute. And their stories they captured our attention, pulled at our hearts to do something, anything to help. And in the midst of the worst economic downturn in more than a century, donations came pouring in as we gave what we could to prop up a cracking medical system. But quietly, 2,000 miles to the west, an even worse situation was beginning to unfold. Infections of COVID-19 were occurring on Native American reservations at a rate far beyond what was already thought to be the worst of the worst. In New York, the average was just over 1,800 cases per 100,000 residents. But among Native Americans living in parts of Arizona, New Mexico, and Utah, that rate was some 27% higher. We're talking about 2,304 cases for that same number of people. So why is this happening? Why are Native Americans also then being hit harder by the underlying conditions such as diabetes that substantially increase the risk of complications of COVID-19? For those answers, to get to the bottom of this, we welcome Dr. Carolyn Trapp to the Exam Room Live. Dr. Trapp, thank you so very much for joining us today.
Hi, Chuck. Thank you. I'm happy to be here with you.
We're talking about some alarming numbers there, obviously, and there are a number of factors at play. But one of the ones that I discovered that really stands out to me is specific to the Navajo Nation, which is the size of the state of West Virginia, if not a little bit larger, yet there are only 4 hospitals for the entire Navajo Nation. Why is that? What is going on here?
Well, Chuck, you're absolutely right. Access to medical care is a problem for people on the Navajo Nation. The hospitals traditionally were part of the Indian Health Service. In more recent years, the Navajo Nation has taken over those hospitals, but The one I'm the most familiar with is in Fort Defiance, Arizona, which is a 35-bed hospital that serves many thousand people. In that hospital, I believe they only have 1 or 2 ventilators available. I mean, you can imagine that a virus like coronavirus, COVID-19, is terrifying for the people on the Navajo Nation. But, it's not just access to medical care that's a problem. Access to water is a problem. Water was diverted from the Navajo reservation years ago. Access to running water is a problem. Something like 40% of Navajo people don't have running water or electricity right now. And I've witnessed people put these big, giant containers into the back of their pickup truck, and they have to drive miles to the chapter house where they pump water from the well. So, if you can't wash your hands in this time, people are living in multi-generation households. It's common for elders to be living with their children and grandchildren. So if people, elders who are exposed to their other family members who are traveling, and then internet access isn't available. So the way many people are staying up to date is through radio shows. But of course, one of the biggest problems is food, and I imagine you want to talk about that.
100%. When I was out in Arizona last year for an event, you and I had an opportunity to meet up. There was a phenomenal event at a high school in Flagstaff. And really, that was my first experience learning about a lot of the issues that were facing Navajo Nation and Native Americans. Clearly, the coronavirus was not in anybody's mind at that point. It wasn't around just yet. Nonetheless, these problems that really fueled the virus certainly were there. The rates of diabetes were just astronomical. But I will say, before we tap into that, to hear you talk about homes without running water or electricity, you and I sitting here today and the people watching this, that's really hard for us to imagine in the year 2020, that there are still great numbers of people who are living under those conditions. But specific to food, we just talked about there only being 4 hospitals for the entire Navajo Nation, 4 inpatient hospitals. Well, I know that there are just very few full grocery stores as well. And I believe somebody out there was explaining to me that some organized bus trips just to get to a grocery store to have access to high quality food.
That's true. Access is a problem. I believe the statistic is 50% of Navajo people receive some sort of food supplement program, whether it's through SNAP or a commodity box. And the foods that are provided are not things that are very healthy. So they include some fresh fruits and vegetables, but they also include canned meats, blocks of cheese, those foods that Dr. Barnard was just talking about that have no fiber and certainly don't feed the gut bacteria. It's access to healthy food is really a problem. And there is, we know that that's linked to these high rates of diabetes and other chronic diseases. We see, and that's why people, Navajo and other Native Americans, have such higher rates of COVID-19, is because they have these underlying conditions that certainly put them at greater risk.
Do you know what the current rate of diabetes is among the Navajo Nation? I know that it's definitely multiples of white Americans, 2.5 times maybe.
Well, so across the U.S., it's around 10%. From census data, we estimate it's closer to 16% for Native Americans. However, among the Navajo, it's thought to be even higher. I've seen rates of 30-35%. It's hard to get good census data, but we know it's epidemic. I mean, everywhere I've gone on the Navajo Nation, I find everybody has a family member who has diabetes. I mean, it's just really a very common, and people unfortunately feel it's inevitable. And I think that's why our work there has been very successful, because we've really been able to offer a hopeful message. As a nurse practitioner, I've seen people change their diet in Michigan and reduce their need for medication, get off of insulin, turn their diabetes around. And our research, of course, shows that as well. So it's been very exciting for us to share this information with Navajo people and other Native Americans who maybe for the first time start to feel that they can get off the road to diabetes.
And I'm looking at data right now from New York State and the comorbidities that are linked to COVID-19 deaths. And diabetes is number 2, only behind hypertension. Is high blood pressure also an issue among Native Americans?
It is, and it's not surprising. One factor with blood pressure, of course, is salt intake. And when we see people eating a lot of processed foods, canned meat, cheese, full of salt. Also, fast food restaurants have moved onto the Navajo Nation and are also in the border towns around the Navajo Nation. So, those are cheap foods that are widely available, and that's a big contribution.
Well, let's talk about traditional Native American foods, because obviously spam and cheese and the kinds of foods that we're talking about, those highly processed foods, were not on the original Native American menu. What are the traditional foods of Native Americans? And if we were somehow able to return to that way of eating, what then do you believe the effect would be on the rates of diabetes, of high blood pressure, and even on COVID-19?
Sure. So 2 points I want to make around food. So one is we often think of corn as being a traditional food, and it absolutely is. And I have to tell you that what I learned about corn in my nursing education is that it's a starchy vegetable and people should really limit it. And however, if you look at the Navajo people who use corn in so many different ways, I mean, they would eat it fresh, they would dry it, they would grind it. Corn was part of every meal. And they didn't have high rates of diabetes. And another Navajo tradition is called the Three Sisters. And this is a tradition of growing corn, beans, and squash together and consuming those foods together as well. They're tasty and delicious together. So those are really traditional, foods that can be grown or harvested. Things like wild onions, wild carrots, wild spinach, these were all really important parts of the diet as well. And certainly the Navajo were hunters, but that was really a small part of their diet. I mean, that it's very labor intensive to hunt for food. So, they did grow quite a bit, and they are doing that now. In fact, those foods are really being revitalized. We're seeing a lot of efforts around the Navajo Nation to help people start their own gardens, and there are farmers markets, and really to encourage people to be able to provide their own food and to reduce reliance on foods that are being brought onto the Navajo Nation.
And at that event, I was privileged enough to attend last fall. There were a number of high school students who actually used these traditional foods and made recipes, prepared like basically a feast for hundreds of people who attended. And these foods were absolutely delicious. But the thing that I took away from that was really the enthusiasm by this, not just because they were getting in touch with their heritage, but also because they were really taking charge of their health at a time when childhood obesity rates were just climbing. They're going through the roof.
You're absolutely right. So you're referring to a program we called Food is Medicine for Diabetes. And this was held in partnership with NACA, Native Americans for Community Action, which is a group that is based in Flagstaff that serves 11 people from 11 tribal nations. And we also worked with Kinlani Bordertown Dormitory, which is a dorm for Native American kids that come from all over who go to school in Flagstaff. And we had a film instructor there who, and a nutrition instructor there who worked with kids, and they put together this great video. In fact, people can see it on our website called nativepowerplay.org. And it's this really cute 12-minute video called Food is Medicine, the game show. And they were really creative in teaching what foods are healthy to eat and then how to put them together in really delicious ways. So that event, we had almost 200 people on a Saturday come to learn from Dr. Barnard was there. We had cooking demos. We had dietitians. We had a number of different wonderful speakers who shared this information, and people literally ate it up. And you're absolutely right. What the kids from Kinlani taught, they brought a lot of enthusiasm for this new approach. And part of the fun is we're not talking about limiting foods or people going hungry or some kind of really challenging diet. We're encouraging people to eat until they're comfortably full from plant foods, and people found cultural connection to those foods, and they found they were tasty and delicious, and that it doesn't have to be complicated or expensive to eat beans and grains and fruits and vegetables.
Real quick, as we wrap this up, can you tell us a little bit more about the efforts we're making here at the Physicians Committee to help the Native American population?
Sure. So one thing we did just past Saturday is we held a 4-hour Zoom webinar, and the president of the Navajo Nation joined us and offered welcome greetings. And it was 4 hours about healthy meal planning, healthy cooking, the science behind a plant-based diet. And we anticipate that we will repeat that program and offer different versions online. We're also making videos. And, I mentioned people don't have internet access, but many people do have phones, and they're able to watch these programs on their phone and join us. And we will continue our efforts. One thing that one of the Navajo directors of a program said to me a while ago is many people have come out to help Native Americans, but the Physicians Committee keeps coming back. And I'm really proud of that, that our supporters have enabled us to offer live programs and now web-based programs. And we've created a number of print resources, and people who want to check them out can find them at nativepowerplay.org.
And we heard the rates of diabetes. We know that the rates of COVID infections, 27% higher than in New York City. Clearly, a lot of work to be done. Carolyn, I know that you and your team are working just tirelessly to help out the Native American population. And that is why you watching right now can also get involved. If you are able to, please make a donation right now. You can head over to pcrm.org/donate and help us with this program and all of the other wonderful programs that we have to educate everyone about health and nutrition and the importance of a plant-based diet and combating so many of these chronic diseases that are just plaguing us as a society right now as a whole. And that is regardless of race, of gender, of anything. We as a human race, everyone is affected by this. So please give what you can at pcrm.org/donate. Dr. Trapp, greatly appreciate your time. We will talk to you again soon.
Great. Thanks, Chuck.
All right. And if you happen to live in Arizona, by the way, you can make an appointment with our doctors and dietitians at the Barnard Medical Center. This is completely online through telemedicine. They can analyze your diet, really zero in with laser focus about what foods you're eating and what foods you should be eating, so that you can help lower your risk of diabetes, of hypertension, all of these conditions that we talk about so often here on the show, of cancer. And then you take that knowledge and you share it with some other people. So head over to barnardmedical.org or call 202-527-7500 to schedule your appointment. Again, barnardmedical.org, 202-527-7500. And it's not just in Arizona. It's also in California, in New York, Washington, D.C., Maryland, Virginia, Missouri, Colorado, Massachusetts, and Kentucky. So many wonderful locations, more coming online every time. So you see that web address and phone number right now, barnardmedical.org, 202-527-7500. That is the number to call. All right. And we will be back with you tomorrow. Another enormous show. Dr. Vanita Rahman, she will be here along with wrestling superstar Austin Aries. Now, this is a guy who grew up in Wisconsin. And anybody who knows anything about Wisconsin knows that it is famous for two things. One, it's dairy. Two, it's insane love of meat. So you got a group of people who refer to themselves as the cheeseheads. Here is Austin, who grows up in Wisconsin, but decides, hey, I don't want meat. I don't want dairy. I want to eat a plant-based diet. And what did that do for him? Well, he only went on to become a multiple-time world champion. So he will be here to document his journey through just the smallest of wrestling arenas all the way up to the grandest of stages and how the diet helped him along the way. So it's going to be a phenomenal interview. That is tomorrow back here at noon Eastern, right here on Facebook and on YouTube. And again, keep your questions coming for the doctor's mailbag. Dr. Rahman is going to be answering a whole lot of them. So if you have one for her, Dr. Barnard, go ahead and post it in the comment section or tweet us using the hashtag Exam Room Podcast. But for today, well, that, my friend, is all the time that we have. My thanks to everyone here at the Exam Room Live, our wonderful director, Donna Steele, and our producer, Laura Anderson. We could not have done this without you. And also another big thank you to Dr. Carolyn Trapp for joining us on the program today. For Dr. Neal Barnard and everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thank you so very much for joining us. Remember, take a stand and keep it plant-based.